Um, Good morning, ladies and gentlemen. The lecture dedicated to road traffic injury. Here we begin. Uh, Different road traffic accidents, they might be sustained by pedestrians, cyclists, motorcyclists, occupants of the vehicle. These are the most common casualties in case of road traffic injuries. And today we will try to discuss several aspects of these injuries obtained by these participants, these people who might take part in road traffic. First of all, uh, traffic accident. Traffic accident is that any case which involves acting vehicles, different vehicles. Road traffic trauma is obtained, then it is caused with the acting vehicle or the parts of it. If the one just falls on the car which is being parked, immobile, not acting, this won't be a traffic trauma. But that's why we are discussing only traumas and injuries obtained in motion. Um, so uh, these traumas, because of heavy weight of the vehicles, because of high velocities of the vehicles, they might involve different type of injuries, uh, variety of injuries sustained by people who are involved in traffic accident. And first of all, we would like to start the injuries to pedestrians. Uh, Injuries to pedestrians caused by impact of the vehicle could be divided to three main patterns of the injuries. These are also representing some stages of the road traffic accident as car pedestrian collision. So, three pattern of the injuries are so-called impact injuries. Then a vehicle strikes the victim. Secondary injuries. Then victim falls on the ground or another stationary objects. In run over injuries, then vehicle runs over some part of the victim's body. Impact injuries. Injuries caused by the direct impact of the vehicle. They could be divided to primary impact injuries and so-called secondary impact injuries. Primary impact injuries are obtained due to initial impact of the vehicle. This is the beginning of the road traffic accident, is car pedestrian collision. Different projections of the vehicle may cause specific injuries. For example, bumper fracture. It is important to mention that in road traffic injuries, just like in any other kinds of forensic traumatic injuries, we distinguish so-called specific injuries representing very specific, not seen in other cases of trauma injuries, like, for example, imprints of radiator or bumper fracture in case of car pedestrian collision. There are also so-called characteristic injuries, injuries which are common for the particular trauma, but might be also seen in other kinds of trauma. And there are so-called non-specific injuries. These are injuries which mostly not seen in this particular kind of trauma. So primary impact injuries are quite specific for the car pedestrian collision. Height of the pedestrian and height of the vehicle also determines the site of injury. Secondary impact injuries. Secondary impact injuries are also injuries caused by impact of the car, but as a result of subsequent fall onto the car. This is subsequent impact of the same vehicle, but in other parts of the same vehicle. Secondary injuries. Secondary injuries, they are usually found on the part which is opposite to the primary impact. Not all the time, but this is common. The most manifested, most pronounced secondary injuries are seen at the areas of the body which are not covered with clothes. This is because such an injuries are mostly sustained due to sliding, due to impact. Of course, this is talked about superficial injuries like abrasions, bruises, and wounds. And run-over injuries, they are seen that the car runs over the body of the pedestrian or parts of different parts of the body. Severity of the injury, of course, depends on the part which is being ran over. Of course, this is obvious that severity of run over through the area of the head is much higher compared to severity of run over through the area of palm, for example. But anyway, it depends on the part of the body and it depends on the weight of the vehicle. The heavier vehicle is, there are severe crushings in there. We could see, as an example of run-over injury, we could see so-called degloving injury. Then parts, layers of the tissues, layers of the skin, layers of subcutaneous tissues are dislocated, are separated from tissues laying beneath them, and there are some cavities, empty space appear. We also might see tire marks as the specific injuries of run over. Sometimes burns, terminal burns, and avulsions also might be seen in this case. At this picture, you could see the, the pattern, typical pattern of primary injuries and secondary injuries. First, impact injury at the top. Primary impact injury, impact by the most prominent, most pronounced part of the car, bumper. This is the bumper impact at the level of tibia or knee level approximately. It depends on the height of the bumper and depends on the height of the pedestrian. In the middle, we see the secondary impact injuries. This is still an impact injuries because it is resulted from impact of the car, but most prevailing mechanism here is falling onto the car, falling onto the windshield and getting impacted by the windshield or hood of the car. And at the bottom, we see secondary injury. Secondary injury, which is resulted from falling onto the ground or maybe some objects which are around the place of the impact. In primary impact injury, as you remember, these are injuries called, for example, caused when the vehicle strikes the pedestrian. For example, then the pedestrian is standing or walking on the road. The importance of primary impact injury is that the body of the victim might bear some specific signs, specific injuries, injuries which are seen in that particular type of trauma. Like, for example, imprint of the bumper, imprint of the radiator, imprint of the logo of the car, which is also could be examined as the very specific, very unique for that particular trauma site. That's why this is of high importance to find the area of the primary impact injury, to find the direct site of it, and if we have reasons to think that this was a car, this was the lorry, this was the bus, in this case, the most probable area of the primary impact injury are the tibias if we're talking about an adult person. Um, the most common parts of the vehicle causing a primary impact injury. These are bumper of the car. This is obvious, seen in case of front impact. These are wings of the car, grills of radiator, headlight, fender, radiator itself, and door handle in case of tangential impact. But anyway, this is an impact which is seen primary. Um, the part of the body which bears the site of the primary impact, it depends on various factors. It depends on was the pedestrian struck from the front of the car or by the side of the car, because these parts of the car there are different protruding, different prominent parts causing specific injuries, and it changes the diagnostic a bit. It also depends on the position and on action of the pedestrian on the road, because if the pedestrian is standing on the road, the injuries will be quite different from situation that the pedestrian was walking or running. If the pedestrian was lying on the road, in this case, the pattern of the injury also would be different from standing impact. If, for example, at the moment of impact, vehicle was braking, driver saw the pedestrian crossing the road, was trying to avoid the collision, was braking severely or rapidly. In this case, we might see descending of the front part of the car, so the site of the primary impact might be at the lower level compared to the situation that the car is, for example, increasing the velocity or just maintains the constant velocity in other cases. The injury, primary impact injury, it is mostly comprising of the damage to the skin and subcutaneous tissues, including muscles, and fracture of the bone. This is typical complex for bumper fracture. That's why sometimes it is better to call it bumper injury, not just a fracture, because soft tissues around the fracture, soft tissues around the bone are also involved to that particular trauma. As I've said, the bumper fracture usually involves tibia, sometimes fibula also might be fractured. We see so-called V-shaped or triangular in X-ray image shape fracture. The shape of the fracture indeed depends on the velocity of the car, but in most of the cases, this is possible to distinguish this triangular portion, triangular segment of the bone crushed, and the base of this triangle is the place where the force was applied. So the apex of triangle shows us the direction of the car motion, and the base of the triangle shows us the place of the force application. If the bumper fracture is located at a different level, for example, they're found on two legs, but the levels are different, this might be an evidence of walking, running, jumping at the moment of impact. Over here, you can see bumper fracture, the wedge-shaped fracture or triangular shape. The base of this triangle shows us the area where the bumper was striking the tibia, and approximate level of the bumper fracture is shown on the left portion of the picture. Area of tibia a bit below the knee joint. Of course, it depends on the height of the person, and it depends on the height of the bumper itself. So it depends on the type of the car. Uh, as I've said, different level of bumper fractures on two legs or absence on one leg might be an evidence of motion, motion of the pedestrian. But sometimes it's just the evidence that the one was impacted, was striking by the from the side. For example, if we see that the area of primary impact is on the lateral side of, for example, left tibia, left fibula first, and tibia. In this case, the fracture on contralateral leg might be absent just because at this time the person was already thrown. The level of bumper injury, it varies to the height of the bumper of different vehicles. So it enables us to not to identify the vehicle itself, but at least to give important information to the police detectives which are looking for the car if the car, for example, had escaped from the crime scene. Impact against a headlamp or mudguards may result in fracture of pelvis because these are usually in upper portions of the car or some fracture dislocation of sacroiliac joint. Impact of the headlight, depending on the type of the headlight, might leave specific pattern, and also the pieces of glass of plastic covering the headlight might also stay there at the area of the injury. Secondary impact injury. The secondary impact injury, which are seen then the body is falling onto the car after the primary impact injury. The body becomes unstable, so the body falls and obtains another additional injuries. Basically, these are injuries of the trunk, and these are injuries of the head, depending on the type and depending on the height of the car. After the second impact injuries, the victim might be thrown onto the ground or thrown onto the surrounding stationary objects. Injuries obtained in this stage would be called the secondary injuries. Injuries as the result of the impact to the surrounding stationary object. Mostly these are extensive abrasions and bruises and lacerations. In some cases, if the body was thrown in the direction of the car motion, some subsequent run over could be seen. This will tend to occur if pedestrian center of the gravity is lower than the impact of the side or scooped up victims being run over by the other vehicles. Injuries, secondary injuries, they are variable and they depend on the area of the body involved. As you remember, I've said already that superficial injuries are mostly seen at the areas not covered with clothes. But even light clothes doesn't prevent severe lacerations and severe abrasions if the body is thrown on the rough surface. The weight of the vehicle and the surface area of the contact, they affect running over. We could say tire marks, especially different types of the tire marks on unclothed and clothed areas of the surface of the body. On unclothed areas, we see grazes, we see bruises of specific pattern, representing the pattern of the tire. And we also see some soiling, the mud, the dust, which had been on the surface of the tire. If runover is seen at the area of the head or area of chest or abdomen, we could see externalization of the internal organs. For example, the brain might be ejected from the cranial cavity, smashed cranial cavity, and found somewhere beside the area where the injury was obtained. So that's why in case of run over, we must pay attention to the surrounding condition, to the surrounding area, which might be examined, and you as doctor might pay attention of the police detective to the wider examination, to the extension of the area of the examination to find all the possible biological traces and all the elements of the clothes and footwear of the pedestrian, because they might be from pretty far from the place where the body was found. In case of compression of the chest, we could see so-called constructive fractures of the injuries. This means that constructive fractures of the ribs. This means that fractures might be located not at the area of the direct impact, but as a result of the compression, the place where the rib is fractured could be a bit in remote distance from the area of compression. We also might see the symptom of so-called flail chest, which could be a very severe consequence if the one is still alive, because the flail chest prevents normal respiration function. Burning on the skin is also possible in case of runover, because the discharge of the hot exhaust from the exhaust pipe of the car might affect unclothed areas of the body. Here is the picture of the flail chest. Due to motion, due to instability of the rib cage, in case of expiration and inspiration, motion might occur, causing some additional pain and ineffectivity of attempts to inhale or exhale air. Also might be associated with pneumothorax and hemothorax, complicating the condition of the patient. Secondary injuries. Secondary injuries are injuries which occur after the second impact injuries, that then the victim is thrown off the vehicle onto the ground. At this picture, previous picture, the victim sustains the secondary injuries from the ground. Head injuries are the most common injuries. And in most of the cases, head injuries are the prevailing cause of the death in this case. There also might be the fractures of the limbs, but fractures of the limbs as the secondary injuries, they are not playing such a great role in mortality of the patients. That's why, of course, they must be examined, because they might bear some necessary information, but it is not that much informative as fractures of the limbs in case of primary impact. Next portion of our today's lecture are the injuries of motorcycle and cyclists. Um, Injuries sustained by motorcyclists are usually much more serious than injuries of the people who are being the occupants of the car. This is because of inherent instability of two-wheeled vehicle like bicycle or motorcycle. Um, Motorcyclists are usually not as well protected as car occupants. Protective gear might be absolutely absent. No helmets, no vests, no protection for elbows and knees. And motorcyclists are often rushing and driving negligently. Some additional causes complicating the consequences of motorcycle trauma are alcohol and drug abuse, some environmental factors, because in rainy or windy weather, it is harder for motorcyclists to control the surrounding situation, and drivers of the car, they also, in many cases, they disrespect cyclists and motorcyclists. They driving recklessly, and that's why it might cause some additional consequences, additional complications in motorcycle trauma. Uh, the most common cause of motorcycle fatality is running off road. Then motorcycle goes off road and impacts some stationary objects or just follows the ejection of the motorcycle from the seat. Most injuries obtained as a result of this injection and falling onto the road. In high speed, this might cause the fatal outcome almost immediately after an impact. Primary injuries are mostly injuries of tibia and fibula as a result of the impact. Secondary injuries are mostly fractures of the skull, ribs, and the spinal column, predominantly the cervical portion of it. And these are the most common cause of mortality in case of the motorcycle trauma. Grease abrasions are very characteristic, very common for that type of trauma due to sliding across the road, even if protective gear is used. Most affected parts of the body in case of motorcycle trauma are the head of the victim. Um, Next, this is thoracic and abdominal region, and of course, the uh, extremities, injuries of the extremities, they follow the next. Fall on the roads, surface and sustaining injuries to the lateral part of the fracture of temporoparietal bone is very common. And fractures occurring in the skull of motorcyclists can be summarized as fall on side if side impact to head causes basal skull fracture, especially hinge type. Impact on the face causes fractures of the facial skeleton with the profuse bleeding. Impact on forehead causes sagittal fractures at the base of the skull. Impact on chin causes mandibular fracture, and impact on crow of the head by fall may cause so-called ring depressed fractures. Uh, Next, the injuries to occupants of the vehicles, to people who are inside the vehicle. Mostly, these are injuries of the driver because in many vehicles there are drivers only, no passengers. But even if there are passengers, driver obtains some specific injuries, some injuries not seen in other occupants of the car. That's why we will pay big greater attention to the traumas of the driver, because the rest of the occupants of the car, they also obtain traumas, sometimes as severe, even more severe than the drivers, but they are not that specific. Sometimes in case of impact of the car to the stationary object, when the car strikes it, ejection of the passenger and driver might happen, causing some additional traumas also. Uh, if the passengers of the rear seat are not belted properly, they are also under high risk of the trauma, because due to sudden braking, uh, they keep on moving due to inertia, and they are impacting the front seat passenger, and they impacting the interior of the car, obtaining some additional traumas due to pressure and due to severe strike. Uh, the driver and passenger injuries depends on the type of the car crash, which could be front impact crash, rear impact crash, and side impact crash. Front impact crash is more common. This happened when one car strikes another car, head to head, or strikes the stationary objects, like, for example, the tree. In this picture, you could see these black spots demonstrating the most dominating areas of injuries of the driver on picture A, and front seat passenger on picture B. As you can see, the driver obtained some specific injuries located at the wrists and elbows, also ankle joints. These injuries are not seen in the front seat passenger. At the same time, trauma of the chest and trauma of the abdomen, in case of the driver, is also more prominent compared to the front seat passenger. This is obviously because the driver has some elements of the car control, as steering wheel and pedal block. Steering wheel causes injuries of the trunk, some additional injuries of the trunk, and also causes injuries of the upper extremities, mostly wrists and elbows, because the one is holding the steering wheel at the moment of the impact. There are also pedal blocks. These pedals, they might injure the ankle or the foot, which is not seen in case of the front seat passenger and rear seat passenger also. Both driver and front seat passenger, they are obtaining injuries of the face, injuries of the skull, injuries of the femoral region, at the knee level, at the hip level, and at the middle of the femur also, because the dashboard in front is the quite solid obstacle, the one might hit against too. As I've said, the pattern of the driver's injury has the tendency to be different from the front and especially rear seat passenger. Fractures of the wrist, specific fractures of the breastbone due to steering wheel are the most common, and they are different. Seeing these injuries, we could easily conclude that this one is a driver of the car. We can distinguish between the driver and occupant of the car. It enables us to make this diagnostic. Fracture dislocation of tibia, fibula, and pelvis may occur from transmission of the force of impact from pressing on brakes and clutch pedals. These are a bit different in case of driver compared to the front seat passenger. Severe impact against the windshield, which could be seen in both driver and front seat passenger, might cause avulsions of the skin on forehead, a basilar skull fracture, and injuries on the head and fracture dislocation. Steering wheel impact injury is the specific injury of the driver. Circular rim, circular abrasion, and circular rim of the steering wheel might cause fracture of the face and fractures of the breastbone. We also might see arch-shaped bruise or abrasion on the chest or sometimes abdomen of the driver. In front seat passenger, what is more common compared to the driver is the so-called whiplash injury due to violent acceleration deceleration force applied to the passenger, especially front seat occupant. We might see motion of the head, especially if the patient is fixed at his seat, but the head moves forwards and then backwards. Due to it, injuries of the cervical spine might occur, and the spinal cord could be also injured then. In case of rear impact crash, then another car strikes that particular vehicle from rear side. This could be low velocity or high velocity rear impacts. Low velocity rear impacts are relatively common, especially in traffic jams. And one of the most common injuries for that are whiplash injury. This is not always the fracture, but even not fractured spinal column might be associated with the fracture of the spinal cord within it. Here the mechanism of the whiplash injury is shown. First, in case of rear impact, head goes backwards, leading to overextension, and then ricocheting forwards. The elongation of the neck, the ruptures of the ligaments connecting vertebrae one to another, and the axonal trauma of the spinal cord. If axons within the spinal cord are traumatized and ruptured, this prevents nervous impulses from conduction to the brain and from the brain. That's why it might be fatal. The picture of the rear impact is shown in high velocity rear impact. This might be also associated with the breaking of gas tank. If the car is acting, distribution of the fuel might lead to ignition, causing additional traumas from the fire. And finally, side impact crash. These are seen when another vehicle strikes that vehicle to the side. Injuries are often severe because the side of the car is less protected than the front and the rear, because the layer of the metal obstacle, metal door is not that thick. That's why injuries of the passengers or the drivers who are sitting on the side of the impact are quite severe and might be fatal at the moment of trauma. There are also additional traumas due to glasses of the windows, which are being breaking, and they are cutting the skin, leading to additional bleeding, additional blood loss. That's why it is also must be we must pay attention to it and taking care of such a patient. Rear side impact is shown here, severe side impact of high velocity. This is the picture of experiment, but anyway, it might happen in the real world situation. We can see linear right angle or V-shaped laceration typically in the face due to glass. We also might see there in the patient some traumas of the spinal column, some traumas of the head. And of course, we need to pay attention that the most affected side of the body is the side from where impact was caused. The other side of the body might be not affected ever or much less affected because there is an empty space on the other side. And finally, rollover crash. Rollover crash is seen that the car rolls off the road, on the road. But if the occupants of the car are fixed properly, if they are belted properly, the belted occupants might obtain relatively moderate injuries, and they might survive if the entire cabin is being not smashed totally. This is because the parts of the core, they are reducing the energy, reducing the force of the impact, absorbing it. Yes, the core might be smashed, but inside of it, people might survive, not even getting serious injuries. If the occupants of the car are not belted, they might obtain severe trauma due to impacts of the interior of the car, due to tumbling around inside the car, striking anything what's inside, and due to injection from the vehicle. And in this case, non-belted patients suffer severe, sometimes fatal injuries. Seat belts. Some people, they believe that seat belts might cause some additional traumas and airbags also. And that's the way some people explain why they do not fasten the seat belts there. Indeed, the seat belts, they provide greater benefits compared to the not belted patients, especially in case of frontal impact. Then seat belts are preventing the ejection of the passenger or driver from the car, and in case of rollover crashes. Wearing seat belts reduces the risk of fatalities of the front seat passengers by 45% because injuries here are less severe except for the whiplash injury. Whiplash injuries in this case could be even more severe. Probability of severe head injury is lower due to maintaining of relatively stationary position within the car. Then the head cannot be impacted on the interior of the car or on the ground. Then the body is ejected. Ejection of the car is less probable in case of wearing seatbelt, but seat belts themselves, they also might cause some additional traumas. The lap belt can produce the tear of abdominal organs, and the shoulder belt might produce abrasions and bruises running obliquely downwards through the chest of the car. Sometimes might even cause the fractures of the breastbone and ribs. But anyway, in such a cases, if the person won't be wearing a seatbelt anyway, the trauma would be much more severe. Even in case that the seatbelts are causing traumas, they preventing harder, more severe traumas. In this picture, we could see abrasion caused by the seatbelt. Then the person was fixed properly. As you can see by the type of the abrasion caused by a seatbelt, we also might distinguish between driver and front seat passenger. If if in this car the steering wheel was on the left side, such a location of the abrasion of seatbelt is the evidence that the one was the passenger, not the driver. But seatbelt also enable us to distinguish particular specific pattern of injury, but at the same time, it might save one from the harder injuries. Well, this is the end of the 2 days lecture. Thank you very much to those who participated. See you in classes.